Needle exchange programs offer free, sterile needles and syringes to injection drug users and eliminate dirty ones. These programs have been proven to reduce infections of HIV and hepatitis without increasing drug use, injection frequency, or unsafe disposal of syringes. Needle exchange programs were first introduced in the 1980s as a response to the HIV global epidemic. It has been found that there is about 11.8 million people in the world who use injectable drugs, and about 13% of these people are living with HIV. These programs are very beneficial to communities in many ways, which is why I am in favor of them. The key roles of needle exchange programs include saving lives, saving money, and slowing the spread of diseases such as HIV/AIDS, hepatitis B and C, and other blood-borne illnesses such as sepsis. These programs also reduce the amount of contaminated needles in circulation and lower drug-related and sexual risk behaviors. Needle exchange programs increase access to drug treatment referral services, testing and diagnostic services, education about substance abuse, along with increasing the amount of interactions with hard-to-reach populations. Needle exchange programs are supported by many organizations and programs. They are backed by the World Health Organization, the American Medical Association, and the American Public Health Association. Needle exchange programs are largely underfunded, however, changes are being made to increase funding. The programs are primarily funded by federal funds, which wasn't allowed until the Consolidated Appropriations Act of 2016 was passed. This act gave states and local communities the opportunity to use federal funds to support needle exchange programs under certain circumstances. The exchange was funded by the Foundation for AIDS Research to lift the ban on using federal funding for needle exchange programs. Since this goal has been achieved, organizations such as St. Anne's Corner of Harm Reduction and the Drug Policy Alliance help support needle exchange programs. These programs are based in New York City and are helping to remove dirty syringes and needles and provide clean ones to a broad community. Besides these programs, needle exchange programs are also funded by private funding and donations. It has been found that people who inject drugs are 22% more likely to contract HIV than the rest of the population. As of 2015, about 50,000 people in the United States are diagnosed with HIV per year. However, needle exchange programs are helping to decrease this rate, and in 2017, there were less than 39,000 people diagnosed. Along with this, 1.34 million deaths resulted from hepatitis worldwide in 2015, and 2/3 of these were the result of improper drug use of injectable drugs. Although needle exchange programs are designed to benefit the population, critics remain to see issues with them. Some common misconceptions about needle exchange programs include that they enable current drug use, increase injection use, increase rates of infections, cause there to be more contaminated needles in the community, increase financial burdens on taxpayers, and increase crime rates near needle exchange sites. These ideas are mainly false, with the exception of an increase in financial burdens on taxpayers. Overall, the prevalence of needle exchange programs in the United States is still very low, with 14 states having no program at all and 12 states only have programs in 1 or 2 cities. Having these programs readily accessible is crucial for their rate of success.